In this video, I want to walk you through 5 of the best supplements that may help with numbness, tingling, stinging sensations, and burning pain caused by peripheral neuropathy. My name is Dr. Grant Cooper from Princeton Spine and Joint Center, and before we dive into the list, there are 2 very important disclaimers that need to be clearly stated. First and foremost, you should always speak with your doctor before starting any new supplement. This is not just a formality. Supplements can interact with medications you may already be taking, and while they can certainly have beneficial effects, they can also cause unwanted or harmful effects if they are not appropriate for your individual health situation. Having a conversation with your physician helps ensure that what you are taking is both safe and suitable for you. The second disclaimer is equally important. There is no such thing as a magic pill. If anyone promises you a supplement that will instantly cure all of your pain or completely reverse neuropathy overnight, it is best to be skeptical and move on. That kind of claim simply is not rooted in reality. If such a pill ever does exist, I will be the first person to tell you about it. Until then, it is important to stay grounded in what science and clinical experience actually support. With that said, there are supplements that make logical sense from a biological standpoint and that have shown promise in clinical studies when it comes to calming nerve inflammation, reducing irritation, and easing neuropathic pain. One last point before we begin is transparency. I do not sell supplements, and no company has paid me to make this video or to endorse any product. What I am sharing here reflects my honest professional opinion as a physician who has a deep interest in improving health and wellness and who regularly treats patients suffering from peripheral neuropathies. I spend a great deal of time trying to understand what truly works, what does not, and what may help patients feel better in a safe and responsible way. With all of that out of the way, let's get started with a countdown of 5 supplements that may help relieve the symptoms of peripheral neuropathy, beginning with number 5. The 5th supplement on the list is N-acetylcysteine, often abbreviated as NAC. N-acetylcysteine is derived from the amino acid cysteine, which is naturally present in foods such as lentils, beans, and bananas. NAC is thought to help improve neuropathy symptoms by suppressing the activation of certain enzymes known as matrix metalloproteinases. These enzymes play a significant role in the development and worsening of neural inflammation. By dampening their activity, N-acetylcysteine may help reduce inflammation around irritated nerves. Studies have suggested that NAC can decrease nerve-related inflammation and reduce pain associated with peripheral neuropathy. While it is important to acknowledge that more research is still needed, and much of that research is ongoing, there is already enough supportive data and clinical experience to justify placing N-acetylcysteine as the 5th best supplement for neuropathy symptoms. Typical dosages used in studies and clinical practice range from about 600 milligrams to 200 milligrams per day. As always, this is not individualized medical advice, and you should discuss appropriate dosing and suitability with your own doctor before starting NAC or any other supplement. Moving on to the 4th supplement, we have omega-3 fatty acids. Omega-3s are often referred to as healthy fats, and they are known for their wide-ranging positive effects throughout the body. These fats have been linked to improved heart health, reduced systemic inflammation, and better overall cellular function. In the context of peripheral neuropathy, studies suggest that omega-3 fatty acids may help prevent further nerve damage and may even support nerve regeneration when damage has already occurred. Clinical research has shown reductions in nerve pain among patients experiencing neuropathic pain, and while larger and more definitive trials are still underway, the existing data is encouraging. Animal studies in particular demonstrate a substantial therapeutic effect of omega-3s on nerve health, and early human data supports their role in reducing pain and disability associated with peripheral neuropathy. Omega-3 fatty acids earn their position as the 4th best supplement not only because of their potential benefit for neuropathy symptoms, but also because of their broad and well-documented health advantages. While N-acetylcysteine may have more direct evidence specifically targeting neuropathic symptoms, omega-3s influence the entire body in beneficial ways. These include supporting cardiovascular health, improving mood, reducing symptoms of anxiety and depression, supporting endocrine function, and lowering overall inflammation. All of these factors make omega-3 supplementation an appealing option for many individuals. Omega-3 intake can be increased through diet by consuming small cold-water fish such as salmon, cod, and sardines, which tend to have lower mercury levels compared to larger fish like swordfish or shark. Plant-based sources such as flax seeds, chia seeds, and walnuts are also excellent options. Supplementation is another effective way to increase omega-3 intake, and for most people, a daily dose ranging from 1 to 3 grams is typical depending on dietary intake. Despite their many benefits, omega-3 fatty acids are not without potential risks. Higher doses can increase the risk of bleeding, and intake above 1 gram per day has been associated in some studies with a higher risk of atrial fibrillation. This does not mean omega-3s should be avoided, but it does mean they should be used thoughtfully and under medical guidance. As with any supplement, it is important to talk with your doctor before starting omega-3 fatty acids to ensure they are appropriate for you. The third supplement on the list is acetyl L-carnitine. Acetyl L-carnitine is an amino acid derivative and a powerful antioxidant that plays a key role in fatty acid metabolism within the mitochondria, the energy-producing structures of cells. It is also involved in regulating nerve growth factors and neurotransmitters within the nervous system. Multiple studies, including randomized, double-blind, placebo-controlled clinical trials, have demonstrated that acetyl L-carnitine can reduce nerve pain and improve vibration perception in patients with peripheral neuropathy, particularly those with diabetic neuropathy. These findings make it one of the more well-supported supplements for nerve-related pain. Typical dosages used in research range from 2 to 3 grams per day. Once again, it is essential to consult with your doctor before beginning acetyl L-carnitine or adjusting your supplement routine. The second best supplement for peripheral neuropathy is one that offers extensive benefits for overall health and has shown strong evidence in both animal models and human studies for reducing neuropathic pain. This supplement is derived from a well-known Asian spice and has been used medicinally for thousands of years. Curcumin, the active compound found in turmeric, is what I would describe as a true superstar supplement. It is a biologically active polyphenol that has been utilized in Ayurvedic and other traditional medicinal systems for over 4,500 years. Curcumin has been shown to help with a wide array of conditions, including inflammatory disorders, digestive issues, high cholesterol, anxiety, metabolic syndrome, and more. Remarkably, studies have demonstrated that curcumin can work as well as or even better than nonsteroidal anti-inflammatory drugs like ibuprofen or naproxen when it comes to relieving joint pain and inflammation. In terms of neuropathy, curcumin appears to reduce nerve pain through several mechanisms. It inhibits specific enzymes and proteins involved in neuropathic pain pathways and reduces overall inflammation by lowering inflammatory markers such as tumor necrosis factor alpha. While large, well-controlled clinical trials specifically examining curcumin for peripheral neuropathy are still limited, the combination of its broad anti-inflammatory effects, strong basic science data, supportive animal research, and extensive anecdotal human experience has earned curcumin its place as the second best supplement on this list. When considering how to take curcumin, it is important to understand that turmeric itself contains only about 3% curcumin by weight, making it difficult to achieve therapeutic levels through diet alone. Increasing turmeric in your meals can still be beneficial and enjoyable, but supplementation is often necessary to reach doses studied in research. Curcumin supplements should include piperine, an alkaloid found in black pepper, which dramatically increases curcumin absorption by as much as 2,000%. This is often listed on supplement labels as bioperine, a standardized black pepper extract. Typical study dosages of curcumin range from 500 milligrams to 2 grams per day. Although curcumin is generally well tolerated and is a supplement I personally take, it is still crucial to review potential interactions with medications and consider your overall health profile before starting it. This makes another conversation with your doctor essential before adding curcumin to your regimen. And now we come to what is widely considered the single best supplement for relieving the symptoms of peripheral neuropathy. If there were ever a moment for a drum roll, this would be it. Alpha-lipoic acid, commonly referred to as ALA, stands at the top of the list. Alpha-lipoic acid is one of the most extensively studied supplements for peripheral neuropathy and has consistently demonstrated benefits in reducing pain, tingling, and discomfort in the feet and legs. ALA is a powerful antioxidant that is naturally produced by the body and is present in every cell. Its beneficial effects on neuropathy are thought to stem from its ability to improve blood flow to nerve tissue, reduce inflammation, and combat oxidative stress. Regardless of the exact mechanisms involved, multiple clinical trials have shown alpha-lipoic acid to be superior to placebo in alleviating neuropathy symptoms, particularly in cases of diabetic peripheral neuropathy. Dosages used in studies range from 600 milligrams to 1,800 milligrams per day, with some reviews finding that 600 milligrams daily for just 3 weeks was enough to significantly reduce symptoms in patients with diabetic neuropathy. As with all supplements discussed here, it is essential to speak with your doctor before starting alpha-lipoic acid to ensure it is appropriate and safe for your individual situation. I hope you found this video helpful and informative. And if you did, I encourage you to like it, share it with someone who might benefit, and consider subscribing to the channel. If you have tried any of these supplements or have experience with other supplements for peripheral neuropathy, I would really appreciate hearing about your experiences in the comments. I also welcome suggestions for future topics you would like me to cover. Thank you for watching, and I wish you the very best of health. When considering supplements for peripheral neuropathy, it's important to understand that consistency and patience are key. Unlike prescription medications that may offer more immediate relief, supplements often require weeks or even months of regular use to achieve noticeable results. The body needs time to respond to these nutrients, reduce oxidative stress, improve nerve function, and repair damaged tissue. Therefore, setting realistic expectations is crucial. For example, while alpha-lipoic acid may begin to reduce symptoms within a few weeks for some patients, others may need several months before experiencing significant improvement. Combining supplements with lifestyle modifications, such as maintaining stable blood sugar levels, engaging in regular low-impact exercise, and optimizing diet for anti-inflammatory foods, can greatly enhance the therapeutic effects and overall nerve health. Another critical point is that not all supplement formulations are created equal. The quality, purity, and bioavailability of the active ingredients can vary widely between brands. Choosing supplements that are third-party tested and sourced from reputable manufacturers can help ensure that you are actually receiving the dosage and potency claimed on the label. For instance, with curcumin, the inclusion of piperine or other absorption enhancers is essential, as curcumin alone has notoriously low bioavailability. Similarly, with omega-3 fatty acids, look for high-quality, purified fish oil or algae-based supplements that minimize contaminants such as mercury or other heavy metals. These considerations are not just matters of efficacy, they are matters of safety. It's also worth noting that combining certain supplements may have synergistic effects. For example, pairing alpha-lipoic acid with acetyl L-carnitine has been studied in diabetic neuropathy, and some trials suggest that the combination may offer greater relief than either supplement alone. Similarly, a regimen that includes omega-3 fatty acids along with curcumin could theoretically provide complementary anti-inflammatory and neuroprotective benefits, addressing both systemic inflammation and local nerve irritation. These combinations, however, should always be approached with medical guidance, especially for patients who are already taking multiple medications or managing chronic health conditions. While the supplements we've discussed, N-acetylcysteine, omega-3 fatty acids, acetyl L-carnitine, curcumin, and alpha-lipoic acid have varying levels of evidence and mechanisms of action, they share a common goal: supporting nerve health and mitigating the discomfort associated with peripheral neuropathy. Each of them targets specific pathways involved in nerve damage and inflammation, offering a multi-pronged approach when used responsibly. The choice of which supplement or combination to use should be individualized, taking into account factors such as underlying conditions, e.g., diabetes, metabolic syndrome, other medications, diet, lifestyle, and overall health goals. Beyond supplementation, lifestyle measures play a vital role in managing neuropathy. Regular physical activity improves circulation, supports healthy nerve function, and can help prevent further degeneration. Even low-impact exercises such as walking, swimming, or yoga can provide meaningful benefits. Blood sugar control is especially crucial for patients with diabetes, as persistent hyperglycemia accelerates nerve damage and reduces the effectiveness of interventions. Anti-inflammatory dietary patterns, rich in vegetables, fruits, lean proteins, nuts, seeds, and healthy fats like omega-3s, further complements supplementation strategies, enhancing both systemic and local nerve health. Avoiding excessive alcohol, processed foods, and smoking is also strongly recommended, as these factors can exacerbate nerve damage and impede recovery. Monitoring progress is another important aspect of managing peripheral neuropathy. Keeping a symptom diary can help track changes in pain, tingling, numbness, and functional abilities over time. This record allows both patients and healthcare providers to assess which interventions are effective and make adjustments as needed. It also helps identify potential side effects from supplements early, allowing for prompt intervention. For instance, if omega-3 supplementation leads to increased bruising or bleeding tendencies, dosage adjustments or alternative formulations may be necessary under medical supervision. Education is a key part of managing neuropathy. Understanding the underlying mechanisms of nerve damage, such as oxidative stress, inflammation, and impaired blood flow, empowers patients to make informed choices about their health. This knowledge also reinforces the importance of adherence to a comprehensive treatment plan, including supplements, lifestyle modifications, and conventional medical therapies when indicated. Neuropathy can be complex, but by approaching it with a systematic, evidence-informed strategy, patients can meaningfully improve both symptoms and quality of life. In addition to the supplements mentioned, emerging research is exploring other potential interventions for neuropathy. Compounds such as coenzyme Q10, certain B vitamins in bioactive forms, and herbal extracts are being studied for their neuroprotective effects. While some show promise, the evidence is still preliminary, and these should be considered adjuncts rather than replacements for the core supplements with stronger clinical backing. Clinical trials continue to refine our understanding of optimal dosing, combination strategies, and patient subgroups most likely to benefit. Safety and individualized guidance cannot be overstated. Supplements, while often considered natural, can have potent biological effects. Interactions with medications such as blood thinners, diabetes medications, or antihypertensives can be significant. Therefore, maintaining an open dialogue with your healthcare provider about every supplement, dose, and duration is essential. They can help tailor a regimen to your specific needs, monitor for side effects, and adjust therapy as your condition evolves. This is particularly important for patients with multiple chronic conditions, older adults, or those who are pregnant or breastfeeding, as physiological changes may alter absorption, metabolism, and safety profiles of supplements. Ultimately, the goal of using supplements for peripheral neuropathy is not just symptom relief, but also supporting the long-term health of your nerves. By addressing oxidative stress, inflammation, metabolic imbalances, and vascular health, these interventions aim to create an internal environment that allows nerves to function more effectively and reduces the risk of further damage. Combining scientifically supported supplements with a healthy lifestyle and medical oversight provides a balanced, sustainable approach to neuropathy management. While supplements alone may not fully reverse nerve damage, they are a valuable component of a broader strategy aimed at improving quality of life, mobility, and overall health. Patient experiences consistently highlight that improvements can be gradual but meaningful. Some report decreased tingling and burning within weeks, while others notice better balance, enhanced sensation, and reduced pain over months. These improvements, even if modest, can dramatically enhance day-to-day functioning and comfort, supporting independence and well-being. Documenting these changes, sharing experiences with healthcare providers, and adjusting interventions based on response are critical steps in maximizing benefits and avoiding unnecessary or ineffective supplementation. By maintaining a thoughtful, patient-centered approach, individuals can optimize the therapeutic potential of supplements while minimizing risks and enhancing overall quality of life. In conclusion, the 5 supplements covered, N-acetylcysteine, omega-3 fatty acids, acetyl L-carnitine, curcumin, and alpha-lipoic acid, represent the most evidence-supported, clinically relevant options currently available for addressing the symptoms of peripheral neuropathy. Each offers unique mechanisms of action, ranging from antioxidant effects and anti-inflammatory properties to supporting nerve regeneration and metabolic health. When combined with lifestyle optimization, medical oversight, and patient engagement, management, these supplements can be powerful tools in reducing neuropathic pain, enhancing nerve function, and improving overall health outcomes. By approaching supplementation thoughtfully, safely, and consistently, patients can meaningfully address the challenges of peripheral neuropathy and support long-term nerve health. It is also worth noting that while these 5 supplements represent the best supported options, they should be seen as part of a holistic approach rather than a standalone solution. Peripheral neuropathy is a multifactorial condition, and addressing only one aspect, such as oxidative stress or inflammation, may not be sufficient. Patients who incorporate supplements alongside lifestyle interventions, including proper nutrition, exercise, stress management, and adequate sleep, tend to experience more meaningful and sustained improvements. This is because neuropathic pain and nerve dysfunction are influenced by metabolic health, circulation, immune regulation, and even psychological factors, all of which can be positively affected by a comprehensive care plan. In this context, supplements act as facilitators or accelerators, supporting the body's natural repair mechanisms rather than serving as a quick fix. In practical terms, adherence is key. Supplements like alpha-lipoic acid and acetyl L-carnitine require consistent daily use over several weeks or months to achieve optimal effects. Patients often report incremental improvements such as decreased tingling at night, reduced burning sensations while walking, or improved hand coordination. Tracking these changes can be motivating and informative, helping both the patient and healthcare provider assess the effectiveness of the regimen. Additionally, monitoring for potential side effects is equally important. For example, high doses of omega-3 fatty acids may increase bleeding risk, while certain antioxidants can interact with medications like chemotherapy agents or anticoagulants. A thoughtful, individualized approach ensures that benefits outweigh risks. Another factor to consider is bioavailability. The body may not absorb all supplements equally well, and formulations can make a significant difference in effectiveness. Curcumin, for instance, is poorly absorbed in its natural form but becomes much more effective when combined with piperine or delivered as a liposomal preparation. Similarly, alpha-lipoic acid is available in both R and S enantiomer forms, with the R form being more biologically active and better utilized by the body. Paying attention to these details can significantly influence outcomes and is a reminder that supplement quality and formulation matter just as much as dosage. For those seeking guidance on integrating these supplements into daily life, timing and consistency can also be important. Some nutrients are better absorbed with food, while others, like alpha-lipoic acid, may be more effective on an empty stomach. Consulting with a knowledgeable healthcare provider or pharmacist can help establish a routine that maximizes absorption and effectiveness while minimizing potential interactions with medications or other supplements. Over time, this structured approach can enhance compliance and ensure the body is consistently receiving the support it needs for nerve repair and function. Education and awareness are central to long-term management. Patients who understand how neuropathy develops through mechanisms like oxidative damage, inflammatory pathways, impaired microcirculation, and metabolic dysfunction are better equipped to make informed choices about supplementation, diet, and lifestyle. This understanding reinforces the importance of patience and consistency, as the nerve regeneration process is gradual and often requires months of sustained support. It also encourages proactive engagement, such as scheduling follow-ups, tracking symptoms, and adjusting interventions as needed, creating a collaborative dynamic between patient and provider that can significantly improve outcomes. Emerging research continues to explore novel compounds and approaches for neuropathy, including other antioxidants, mitochondrial support agents, and neurotrophic compounds. While the evidence for these newer interventions is not yet as robust as for the 5 supplements highlighted in this video, staying informed about ongoing clinical trials can provide options for patients who may not respond fully to conventional supplementation. These developments highlight the evolving nature of neuropathy management and underscore the importance of combining current evidence-based strategies with openness to emerging therapies, always under professional guidance. Finally, the overall message is one of hope, empowerment, and practicality. While peripheral neuropathy can be challenging and at times frustrating to manage, the combination of scientifically supported supplements, lifestyle strategies, and medical oversight offers a realistic pathway to relief and improved quality of life. Each supplement discussed, N-acetylcysteine, omega-3 fatty acids, acetyl-L-carnitine, curcumin, and alpha-lipoic acid, brings unique benefits, targeting inflammation, oxidative stress, nerve function, and metabolic health. Together, they provide a comprehensive approach to supporting nerve health, reducing pain, and promoting functional recovery. Incorporating these supplements should always be done thoughtfully with attention to dosage, bioavailability, potential interactions, and individual health factors. Regular monitoring, both of symptoms and of any laboratory markers recommended by a healthcare provider, can help fine-tune the regimen and ensure safety. Patients are encouraged to maintain detailed records of their symptoms, any improvements, and any side effects, which can guide ongoing adjustments and enhance communication with their medical team. In conclusion, supplements are a valuable tool in the management of peripheral neuropathy, but they work best as part of a broader, integrated strategy that includes lifestyle modification, medical oversight, and patient education. The 5 supplements discussed here represent the most well-supported options available today, backed by a combination of clinical studies, basic science, and anecdotal evidence. When used responsibly and consistently, they can help reduce neuropathic pain, improve nerve function, and enhance overall well-being, providing hope and tangible benefits to those living with this condition. Thank you for taking the time to learn about these interventions. Your engagement, questions, and experiences are invaluable, not just for yourself, but for the wider community managing peripheral neuropathy. By approaching supplementation with knowledge, caution, and consistency, patients can meaningfully influence their nerve health, reduce discomfort, and support long-term functional improvements. Remember, while supplements are powerful tools, they are most effective when combined with a healthy lifestyle, proactive symptom tracking, and regular consultation with healthcare professionals. By integrating these strategies thoughtfully, individuals with peripheral neuropathy can take meaningful steps toward relief, improved quality of life, and lasting nerve health.